In my paper, I addressed how horizontal and vertical communication can improve cross-function, cross-departmental hospital teams. I looked at which roadblocks might be encountered when professional paths put coworkers in silos. It could hinder us from understanding each other's perspective. I'm looking at this topic so I can apply tools to strengthen communication at the hospital. I work at St. Louis University Hospital. It's part of a larger SSM healthcare system. The whole system is a complex and dynamic organization. The hospital is part of an open system that takes resources from the environment and transforms them through the work of everyone at the hospital to provide service to patients. And as an open system, services provided in the hospital are affected by government regulations, new medical processes and technology, and patient feedback. The operating team where I work is composed of people that are certified in their professions, and the cross-departmental teams tend to be organic in decision making while we're in there. Our organic team has an unclear hierarchy with an emergent leader, but this is usually our surgeon. The team can adapt to meet the needs of the patient and make decisions together. In times of uncertainty, the team becomes more organic, making decisions and caring for the patient by working directly with each other. Review of the literature indicated a shift to the matrix organization model for a hospital. DAFT agreed with this. It's a good fit for operating team members making complex decisions in a surgical setting where there are frequent changes depending on patient needs. Vertical communication manages actions between the top and bottom of the organization, with the bottom carrying out the goals from the top. Within the hospital, hierarchy referral is something I see when a patient caregiver may ask a question to a mid-level. This would be like a PA, and if it's not answered, it's then passed up to a physician who is seen as the top of the hierarchy. The physician will solve the problem and pass the answer back down that chain of command. One of my articles, Hughes, found communication is hindered when looking at a hospital team because there's a vertical hierarchy within it. Generally, the doctor leads, and a team member perceived as having a lower position may hesitate to share information. The author of this article added that it's critically important that there is a standardized communication tool. Bartels is another article. He found that although professionals identify strongly with their profession, the vertical communication allows for organizational identification. Professionals perceive it as not necessary to do their job, but it's appreciated and helps with organizational identification. So this looks like a fun team to be on, a little different than the hospital. But that same study by Bartels was conducted to see if hospital professionals identify with their profession or with their organization. And it showed that we identify most strongly with our profession. It was indicated by this study that horizontal communication appeals to us. The O'Daniels and Rosenstein study showed that in a 4-day period, a patient may interact with 50 different employees. So when communication breaks down, errors can occur that affect patient safety. Part of the problem is that we have our own education, certification, and role. We work by ourselves, even though we're part of a hospital team. When members communicate with each other, we're discussing information from our professional role, and we share different perspectives, showing horizontal communication. A different article, Robol, found that the roadblocks to verbal communication are lack of standard assignments, staff differences due to professional background, high workload conditions, multitasking, and interruptions. It was noted that the crucial time that communication breaks down is when combining information from charts and handing over information. It's difficult for team members to understand what skill and knowledge each other brings, and there's a need for horizontal communication so team members have no hierarchy concerns. Staff discusses finding the right balance between vertical control and horizontal coordination. Vertical controls are goals, stability, and efficiency. Horizontal is innovation and learning. The right balance hinges on the needs of the hospital. If the organization is not balanced right, staff says there will be a lack of collaboration, delayed decision making, lack of innovation, and poor employee performance. My literature review included Reem, who looked at communication skills on medicine teams. He thinks we need to find which communication skill correlates with good patient outcomes, and then program directors can focus on training team members in this skill. Tools for organizational development can be used for vertical and horizontal communication. Two possible tools are DKit and Excel inventory. I'm going to talk about DKit. So here's all the capabilities of it. It's like a virtual whiteboard. This would be nice when planning a complex surgery. The anatomy could be drawn, supplies listed, and educational videos or slides uploaded. It would lead up to the patient procedure, physicians, mid-levels, operating room, ICU nurses. We could all access and review upcoming plans through the notes, drawings, or posted videos. It'd be a good tool to collaborate on ongoing updates. This is a video from DKit they had on YouTube of someone actually using their whiteboard tool. It can be used on existing workstations, laptops, tablets, and cell phones. It has 30 tools to use, 60 templates, and application downloads. Training for use is free and available through their website. The price is $7 a month per member. Literature reviews showed that use of a whiteboard, especially with written daily goals, improved patient care and team communication. In the hospital where I work, I could see the real-time use of a virtual whiteboard working for OR nurses and ICU nurses, as well as anyone planning for an upcoming procedure. My key takeaway for this paper is the need for strong horizontal communication within a cross-department, cross-professional team, and balance of vertical and horizontal communication. The literature review supported this thesis. As far as reflection, in the future, I'll be more sensitive to anyone's suggestions because I realize how difficult it is for some people to even share them. I understand the importance on identifying ways to improve communication at work. I can see where a tool such as DKit could provide for future research while we're using it and while it's helping us. These are my references, and this concludes my presentation.